season change brings with it the probability of your newborn getting cough and cold. Our expert Dr. Archie Hola tells us how to prevent the baby from these problems.
Cough and cold is a common problem in children. It typically happens during the change of weather, when winter is transitioning to summer or when summer is changing over to winter. Generally, children between the age of 1 year to about 4 or 5 years can have as many as 8 or 10 cough and cold episodes in a year. In the majority of instances, they are because of viruses. And because they are viral in origin, there is generally no need to give antibiotics for these conditions. Usually, the pattern is quite typical. The child gets fever for about 2 or 3 days, and along with that, the child may have sneezing. The child may start coughing. After 2-3 days, the fever comes down, the child's activity improves, the child becomes less irritable, but the cough tends to continue for at least about 8 to 15 days. What are the danger signs that we should look for whenever a child has got cough and cold? One, if the child is persistently getting high fever, and high fever is defined as fever more than 101 degrees Fahrenheit. If your child becomes breathless, that means he starts panting as if he has come running from somewhere. So at rest, if your child is breathless or panting, that is the second sign when you need to take your child to the doctor. Sometimes the infection can pass from the nose and throat into the ears. If your child has excessive crying, which is not consolable, you need to take your child to the doctor. And apart from that, if your child becomes very lethargic, the child just becomes unresponsive, then that is another indication to rush the child to the doctor to get a checkup. Other than this, there are a large number of conditions which can also cause cough, which can cause wheezing, which can cause breathlessness. If your child is not getting better in 2 or 3 days and any of the danger signs are there, please take your child to the doctor for a checkup and further treatment. Like I said, most of these infections become all right on their own without the need for any antibiotics. So how do you treat these infections? At what stage should you take the child to the doctor? What are the danger signs? The commonest problems that happen during the first 3 days are fever. And fever, if it goes very high, it can cause a problem for the child. So it's very important that fever medications should be given to the child in a dose that is prescribed by your child's pediatrician. If the fever is not coming down with the fever medications, or if the fever is going very high, it's important also to sponge the child's body. During summer, this sponging can be done using ordinary tap water. During winter, it can be done with a little warm water. It has to be done over the entire child's naked body. And it should be done till the temperature comes down to around 99 degrees Fahrenheit. Apart from this, the child often has running nose or a blocked nose, for which you should use saline drops in the nostrils to clear the nostrils. And in addition to that, the room can be humidified by using a steamer. An older child can be given a steam inhalation with the steamer, or he can be made to do gargles. If the child is having a lot of secretions and is not able to take steam, then even nebulized saline can be given. That requires advice from your pediatrician, who will tell you how and when to use the nebulizer. Antibiotics are generally required only if the child is very sick, if he has certain danger signs, or if the fever persists beyond 3 or 4 days. That would be prescribed by your doctor. Please do not start antibiotics on your own at home, because most of the times antibiotics are either not required or they can actually do more harm to your child.
For more on baby care, log on to onlymyhealth.com.